Thank you, Tony. Okay, good morning, everybody. Good morning, Commissioners. Welcome to the May 4th staff meeting. So we will turn it over to the County Manager, Tom Stoltz.
Good morning, Chairman and Commission. 3 items for workshop today. One is Chris Labram is here to talk about several building and construction issues. He's going to talk about the 2019 elevator and escalator code. He's also going to talk about some imminent movement that's happening regarding plumbing codes within Sedgwick County, and then he has a little bit to talk about wastewater as well. So Chris has 3 items. Then we'll shift over to a COVID discussion. We haven't talked about that for a while in staff. Maybe give a bit of a vaccine update, and then I think we want to look at a potential new slide for the dashboard that Chris Duncan will be zooming in to show us. And have a discussion about the dashboard. We haven't really talked about that for several months. So, and then Mike or Justin at the end want to give an update on Senate Bill 286 and some other a new bill which is surfacing at the state legislature that you should be aware of. So 3 items today. We'll start with Chris and go from there.
Good morning, Chris Labram. Welcome to the Commission meeting.
Good morning, Mr. Chairman. Thank you, Commissioners. Chris Labram, MABCD for the record. And so as the manager mentioned, a few items to blast through today. Let's see, it looks like I went to the end of the show. We'll start with elevator codes. So as part of our effort to, as I believe you all know, the pandemic 2020 derailed a lot of ongoing code adoption efforts. So as we continue to recover those, the next up is the adoption of the safety code for elevators and escalators with local amendments. So this is Article 4 of our Unified Building and Trade Code. As always, updates the code, and then again, we do have local amendments. This code is an American Society of Mechanical Engineers standard. We'll see a little bit more about that later. Also, as the manager said, it covers both elevators and escalators throughout our jurisdiction. This would be mostly commercial, but residential homes that do have an elevator would fall under this. And then just part of our trades code cycle where we try to update those every 3 years along with the national and international codes in order to stay up with industry and emerging technology. So a list of the codes that this coordinates with and across. You do see reflected in there a few different ones for mechanical and plumbing, and that's based on, again, ongoing adoptions. The 2018 International Fire Code at the bottom of that slide has been adopted by Fire District 1 and is actually being heard in City Council this morning. So Mr. Capello's over there as part of that with the fire department. And then, so there for reference. This particular code was last adopted in August of 17. That was the 2016 version. You see there the official standard listed, and that was with 23 amendments. This changes us to the 2019, and we've been able to reduce to 18 amendments. So updates or incorporations with the baseline code allowed us to actually delete 8 sections from our UBTC. So we're very happy to do that. Anytime we can consolidate, reduce that, have everything in one book. So again, baseline code actually adopting a lot of the things that we had amended into our codes. We did have to add one item back, referencing 911 protocol. So in our last adoption, I know it's kind of an in the weeds thing, but we removed the requirement for having a landline or a hard line for the emergency telephone, meaning it can be digital, so it can be internet, protocol, etc. By removing that entire section, we also removed the exact clarification that said that you call the dispatch center first, not 911. So there was a area there where we were not as clear, and then we actually did have a few installers just go ahead and hook it up to go to 911. So we don't want that to happen first. Only 911 if it's a full emergency should go to their to the elevator's dispatcher first. Also of note that we have an associated code which has just been released in its 2020 version for platform lifts and chair lifts, but these codes actually do not overlap. So while it associates with other codes, it remains separate from elevators and escalators. So as is normal with our review process, get it through all of the local stakeholders, industry stakeholders. Main player here was the Board of Electrical Appeals, who ran the review and made a lot of the contact with industry. Major industry associations that were involved is the elevator constructors. They are actually based out of Kansas City, but they cover the local contractors here as well as part of their union. Obviously, both Fire District 1 and Wichita Fire were heavily involved in this, the majority of the elevators, of course, being in the city of Wichita, but we do have several elevators at Spirit that do fall under county jurisdiction, so we do have some in the unincorporated. You will see two substantial changes to our current practices. One of those slightly more restrictive, one of those is less restrictive. We'll get to those on the specifics. So based on, of course, will of the commission, plan from here is to set the public hearing, which right now is an agenda item for May 12th. Then that would set a public hearing for June 16th. Pending the results of that, we would get it to the city council as soon as possible, probably 2 weeks after that. And then we would look to adopt or to go effective the 1st of October. So as we go into public hearing on the 12th, we would, of course, provide the commissioners any level of detail beyond this that you would like, provide you the red line copies, the full code if you'd like to read it, the list of significant changes, etc., and happy to answer any questions associated with that. So the changes that we want to make sure that you all and the public are aware of. First one is emergency signaling devices. So again, a great thing for safety and for especially our disabled community where this may apply. So this requires that new elevators have a message display panel, and that would allow then digital display if there's a situation where the emergency button has been pushed. That would allow the dispatcher who picks up that call, and only those dispatchers, so it would not be authorized beyond that, to then access a screen, text, visual means of communication with those in the car. Related to that is it also requires video display. So the dispatcher would also then be able to actually see a video of what's taking place in the car, immediately call 911 if that's required, or otherwise then assess the situation and respond appropriately. So again, while a little more restrictive and a slight added expense, it is something that the industry has taken note of and been pursuing lately because it's such a big added safety feature. So the decision was to, it's been authorized in the past, but the decision was to go ahead and make this a part of the code and mandate that those safety features be included.
Mm-hmm. And Chris, those are for new elevators only?
That's correct.
Thanks.
Yes, so. And then, so one of our other major changes, we do have some residences that place an elevator, and up until now, the code required them to actually have an elevator door with that, which is, of course, not as aesthetically pleasing. So technology has advanced to the point we can accommodate still a safe elevator while allowing them to go ahead and put a door frame and a door that looks like all the others in the house in front of the elevator. So that's going to be allowed in this version of the code. And then this is the 911 piece that was discussed a little bit earlier. That exactly there it requires that it call the elevator dispatch and not allow it to go directly to 911, which especially because those emergency buttons are pushed accidentally often, sometimes by children, etc. So if an elevator is set up to go directly to 911, they get a lot of just false calls, and we, of course, want to avoid that. And that, Commissioners, covers what I had on this one. There
Okay.
are, I'll
Thank
gladly
you.
stand for any other questions.
Well, thanks for the presentation. Don't see any. Commissioner Howell.
Well, thank you, Chairman. Hey, I've never pushed one of those buttons before, so I don't know what happens. Is this a 24/7, 365 monitored?
Yes.
Is that something,
Yes.
where is that? Is it
So
somewhere?
it, and I can have Mr. Nordick speak to details on that, but it's based on the elevator companies where they station those. So it'd be similar to like an ADT or one of those type call centers for a home alarm. Each elevator company, manufacturer, installer, they have a base with an on-call call center that has to be on and monitoring all of their elevators.
So are they also the ones that are monitoring on these newer elevators, are monitoring the video and doing the text messaging?
Correct.
Okay. And I guess, so the new elevators, I've never seen one that has these features. Is that's the new technology that's available right now?
It is, and it's how long has that been on the street, Chris?
2 years, and we actually have that video, but I didn't know if you brought that.
Yeah, and I didn't, I thought it might be better to mail that. We could queue it up if we want to see it here. We want to be careful because it was produced by a manufacturer, and we do not want to endorse, of course, any one manufacturer, but we do have a really good video on YouTube that just describes how the technology works.
So I appreciate the chairman's question, but let me just verify. So if someone does a major remodel on our building, are they going to have to upgrade to this standard?
That would be an existing elevator, so they would not be required. They would be authorized but not required. It would only be required in a brand-new installation of an
So even if they
elevator.
did like a 50% or 60% remodel, it would still
Correct.
not be required? Okay, thank you. That's all my questions.
Commissioner Dennis.
Thank you, Mr. Chairman. I don't really have a question, but I do have a request. Could you have your elevator guy look at the first elevator here on the north side and figure out why that thing bangs every time you get in it? Because Papoon is worried that it's going to kill him, so we're trying to preserve our attorneys, so thank you.
We're on it, sir.
Okay. Don't see any others, so move on.
All right, next up is a revision of the Sedgwick County Sanitary and Wastewater Treatment Systems codes. Both of these are county codes, so they affect the unincorporated portions of the county, and then, of course, anywhere else in our jurisdiction, if they would like to adopt and follow those standards, we're happy to contract with them and do so. These follow a fairly lengthy process because they are KDHE-approved codes. And have KDHE review and publishing requirements. They do also, at the end of all of that, require a public hearing for code adoption or revision. So that's where we're at now, is we're looking to officially send this to KDHE for their initial approval. They have reviewed the code. We've been back and forth with them 3 to 4 times, okay, a couple times now, for them to look at the updates we've made, provide input. We've had a couple conversations with them on the phone to work that out, and we're ready to put the revisions forward. So both of these codes were last updated in 2007, which we'll talk a little bit about as we get through this. The sanitary code specifically is Chapter 14, Article 5 of County Code. That is more, so we have 3 sections of sanitary code. The actual sanitary code covers more of the high-level requirements, licensing, permits, things of that nature, overall minimum standards like the minimum lot size you could have a sewer lagoon on, etc. The wastewater treatment systems is Chapter 23, Article 5, and then it is more specific with requirements and location standards. For example, how far away, so setbacks, distance from other water sources, et cetera, that a treatment system would need to be. Safety minimums and construction policies. One thing to note here is the detailed construction policies are not part of the code. As soon as we get to the point where KDHE does not have to approve it any further, we take that out of the code so that we can still make those changes locally without having to go back through the state. So most of the detailed construction standards, et cetera, are in county policy, not code. So the third code associated with this was the domestic water well code. That's chapter 27, as you see there for reference, and that was revised in June 2019. So I'll go ahead and go to the next slide. You do note a little bit of change there, so not a lot of, or a little bit of time lag there, not a lot of significant changes to the codes. The main one is updating our reference agency. But we did, at the time that these were first looked at for update with MMBCD, there were some fairly aggressive changes suggested by commissioners at the time to remove or lessen a lot of the restrictions. KDHE did not agree with those. Staff was very hesitant with several of those. So there was quite a bit of discussion with that, which delayed kind of bringing these forward any further. I think we've worked all of that out between KDHE, us, and hopefully the commission as well, to have a good balance of safety without being overly restrictive in any way. So behind that, we also have some clarifying language. Of course, you learn as you go that the portions of the code that create questions. So Tim has worked to clean up and clarify several areas there. A lot of the changes in this update the definitions based on the national organizations, state organizations that we're a part of. Our definitions were not any different in in actuality. It was a semantics type thing, but at that, in most cases, but then that of course makes it standardized, makes it a lot easier to manage. And in those cases where there was any conflict, we made sure that we reconciled that. Another major thing that this does is aligns our license renewal processes for the installers, for the technicians who work on these systems with our other trades. So their licensing was similar. They were not required any continuing education, or not, I should say, at this point. So this does then put them in that same cycle of requiring 12, also 12, right, Tim? 8. Oh, it's 8. Okay, they are a little less. Sorry about that. So 8 versus 12 for other trades, but they have 8 continuing education units every 2 years to maintain their license and or certification. And then another thing that we changed is if there was an issue with the system or the contract for the advanced systems that we run, that those are reported back to Mr. Wagner and our land use department. We had sole responsibility, or at least as far as our enforcement responsibility, was placed on the property owner. So even though we would normally go through the contractor to get those, it was often a question of or to the contractor. If it actually came down to an issue, then we were tied to going after the property owner. So we've corrected that to make them all responsible for their work, and their part allows us to to hold the maintenance providers more responsible for their service reports and their contracts. So again, on this one, timeline will be a little extended. So pending, of course, will of the commission today, we will also provide the detailed red lines on these codes. Luckily, they're not as long. Sanitary is 5 pages, wastewater is 16. But we'll provide that red line information and any further background, and look to set an agenda item, which would simply be commission approval to send what we have to KDHE. We would then come back to set the public hearing, then hold the public hearing and adopt the code. So especially with the staffing of KDHE right now, we're several months out from actually being in front of you to adopt this code. But we'll move it as quickly as we can. I think that that covers all of my items on this, if there are any questions.
Okay. Commissioner Howell?
Thank you, Chairman. And you and I have had lots of discussions about this in the past. I guess I don't know where we ended up on some of these things that were kind of in flux between the county and KDHE. I don't know where we ended up. So I guess I would like to this doesn't really get into the details at that level. So I guess I'd like to find out, where are we on things like the 2-acre lagoon, for example? And we had, I think, a local effort to make sure we site that lagoon so it's not next to the edge of the property, closest to the neighbor's house, things like that. I'm not sure where we ended up on some of this stuff. So Is that part of your red line?
And yes, it would be in there. We would also be happy to meet with
Sure.
you if we'd like, Commissioner, and we could go over all that in detail, especially with that history.
Sure.
Tim or I can answer questions here as to that level. So we maintained the lot minimums that we currently have, but then there are cases where Tim can vary that when those make sense.
Okay. I guess I would like maybe 20 or 30 minutes sit down just to kind of go through some of this together, but it's not, I have no reason to oppose anything that's been presented here. I just like to understand it a little bit more deeply, because I've had these long conversations in the past. I wanted to find out where we are.
And we had, of course, yes, we had planned, especially where you had been involved in that early on, sir, we had planned to specifically contact you and offer that, so.
I appreciate that. Thank you. Thank you, Chris.
But absolutely.
Thanks, Chris. Yeah, I think a
Ready
meeting,
to-
separate meeting would be good for that one, to update. Okay.
Are we good to move on to plumbing?
Yes.
So this one, I don't have quite as much info for, but we'll discuss as needed. So currently in unincorporated, we're running a dual code system. So that consists of the 2015 Uniform Plumbing Code with amendments and the 2015 International Plumbing Code with amendments. The UPC, the 15 UPC was adopted in 2016. The IPC as a baseline code was adopted then as well, but without amendments. It took us until 2018 to actually get those amendments in place. So that speaks to the discussion, the debate, et cetera, that's been associated with that. We did want to give the industry an ability to test and use the code. We did find some use. There are some who use it. We still do find it as a safe code, as a viable, a usable code, but we have not seen it catch and gain the momentum that would justify continuing to try to do two codes at this time. City of Wichita has remained on the UPC only, and at this point in time, they are still not interested in trying to move forward with the IPC just based on the amount of industry debate that it has caused. So again, as mentioned, we had a defined test period, and there's a ton of detail that we could provide, obviously, to any questions that would be appropriate to discuss here or in private settings. Mr. Little is here and has, I think, a briefcase full of reports over the last several years. But the bottom line is that I've seen over the past 4 years, I've seen as low as 6% on a month and as high as about 16 to 17% on a given month or a quarter, to where those permits that would be eligible to use the international code actually pulled the I-code permit. So as with our current business model, it is just not, just is not something that is a high use in the industry. And then those proponents of the uniform code are very passionate and outspoken about the use of the uniform code. So you see the delays in adoption. I think I've also got here, yes, last bullet, that we're moving to the 2021. So that involves reviewing the 2018, and to a great extent, given this debate over which code we're using, how we'll use them, et cetera, we didn't even get the 2018 adopted. And so went ahead and skipped to the 21 once COVID, et cetera, delayed some of our adoption at that point. So the plumbing codes are a little behind the rest of ours. I need to try to catch that up. We have a larger board now. We have a 9-member board that is working very well together. They've got some good progress. So we do have independent representation on that board. The board and the review committee they are reviewing the IPC as part of this, and they are including amendments that are basically the tenets of the IPC that the industry has requested, that we have requested, those areas that brought us to adopt that in the first place. They are seeking to accommodate those. So we will see and expect amendments to come forward with that will accommodate the IPC. And my recommendation is that we move forward with the UPC only for now. And at whatever point in time we bring the IPC back for discussion, it will be in a different format. It'll be based on business needs. The IPC won't go away in my world. Any federal, state, school, any government-related building is going to be built. Most medical buildings, et cetera, are built to the international standards. So there's still a lot that we do with that code. And having the UPC in place certainly does not mean someone cannot plumb to the IPC as well, as long as it still meets the UPC standards. So the codes are getting more similar as we go forward too, which will help. We do see some areas where the IPC can help with cost. Of course, the current cost of materials has put all of that on its ear for the short term. But so that is where we are at with the plumbing code. We'll gladly stand for questions there too. And
Commissioner Howell?
Well, thank you for the briefing. Thank you, Chairman. I don't even know where to begin. Have we talked with the builders about this plan and see what they're, has West
Yes.
Gallion been informed on this?
yes, WABA prefers the IPC, but also similar situation, understands the amount of resources right now that we're draining over a small number of permits and the debate. So again, based on that as well, this won't go away. In their world, the move to accommodate their request through local amendments, it covers their needs, their requirements for the time being.
When you say 6 to 17% of eligible, are you talking about just the unincorporated areas of Sedgwick
Yes, sir.
County?
So those would have been any area of our jurisdiction where the combination of the project and the location allowed for use of the IPC.
I am curious to know on the jobs that were, the permits were pulled were UPC. Are those jobs where the IPC versus UPC would have made a difference in the work that was being done? In other words, was it a construction job where there was lots of venting and wastewater installation?
Well, I'd say there's two parts to that. So the UPC was amended to allow some of those items to be used. So I think you had several scenarios where, since companies were used to using and pulling permits under UPC, and that's what they did when they worked in the city, if it accommodated what they were doing, they just continued to go forward with their normal practice. Jason, is there more you would like to add to that specifically? Yeah, and then again, there were some, I think where we mainly saw use of the UPC or of the IPC, excuse me, were the companies that were trying to help and gain momentum in the IPC. So they would use those when they had the option. Most companies, again, didn't. We just didn't see a lot of people really go out of their way to use it. So it was a positive that we got usage, because we did get some usage. We did see that as very positive. We didn't see any issues. We haven't had, as you all know, we haven't had any reports of problems beyond anything we normally deal with. So the IPC was proven as a safe and usable code, but just not high enough usage.
How many inspectors do you use for plumbing inspections?
So we have our supervisor and 3 inspectors.
And all 3 of those are able to do IPC or UPC inspections?
Correct.
Okay. So where's this additional cost coming from that you talked about? You said there was some cost.
The main cost is in trying to get the code advanced, purchase of books, et cetera, that goes with the review, and the amount of time and effort that we're putting towards just trying to get our codes in place. We do have a little bit of extra training that we incur when we're keeping up with 2 codes. It's not grossly significant. The main cost is in the adoption process.
I probably asked a question that I think Jason wants to answer, but I do have other questions though. So if Jason, if you want to come and speak to this, I'd love to hear your side.
For the record, I'm Jason Little, Chief Plumbing Inspector with the MABCD in Wichita and Sedgwick County.
So right now, do you feel that having a dual code or having IPC is part of our options here in Sedgwick County? Has that been a problem for you or for your inspectors?
At times, it can be a little challenging to parse out the fine differences in fixture loadings and trap arm allowances. Most of the differences are very subtle and fine. How the fixture unit loading of drain, waste, and vent is significantly different in the limitation of values on piping. One of the things that's been brought up is that in the IPC, it doesn't strictly limit the number of water closets or stools that can be on a 3-inch line, except by total value of fixtures. And if you calculated that out, it is potentially possible that you might have a situation where somebody tried to put 15 toilets on a 3-inch line. The Uniform Plumbing Code had strictly limited the number of stools allowed on a 3-inch horizontal line to 3 for decades. But in the 2021 code, that has been changed to 5 toilets
That's
on a
under
3-inch line.
Under UPC?
Under the UPC. So it's become a little more liberal and generous in that regard. Additionally, appendices have been added to the Uniform Plumbing Code, which bring in some of the concepts of waste and venting that are long-standing traditions of calculation and installation and design for systems. So the body of the UPC may not have it in there, but it is included in the appendices. And if all those appendices are adopted, then it becomes more and more similar. One of the most controversial subjects that came up about this was the use of what's called an air admittance valve. And in the 2016 adoption, the usage of that in the city of Wichita was very limited to repair and remodel only. In circumstances which it was structurally impractical to get a vent out to the atmosphere, which is the standard method of the Uniform Plumbing Code, is vents which combine to an aggregate to equal the sewer to provide an assurance of ventilation throughout the system. Whereas in the international plumbing codes, there was only one vent to the atmosphere required to the building drain, and it could permit multiple air admittance valves to try to balance the pressure in the system and maintain it to within 1/10 of a atmosphere of change.
So under UPC, they do allow the air admittance valve on remodel. Say you're installing a kitchen island, for example, on a remodel, you would be allowed to use a air admittance valve in that case.
That has been true since the adoption in 2016, and it is my understanding that the current code review committee and plumbing board is looking at opening that up to residential new construction.
Yeah. So again, I would like to encourage the UPC advocates that if they would be willing to take a couple of my comments and at least explore them. I would like to minimize the roof penetrations by allowing venting to be connected in the attic space, so there's less roof penetrations. If you look at a UPC plumbing job versus an IPC plumbing job, it's really obvious which one you're looking at. That's one. I would like to be able to reduce the size of the venting as it goes on up. Once it's no longer wet, it's only dry. It'd be nice to have a reduction in size. In other words, if you have a 3-inch wastewater from a toilet, you don't need a 3-inch vent going up. I would like to see something that will allow that to go down to 2-inch, for example. I think that's reasonable. I'd like to be able to take those different parts of the house or building and and some of them together so that you have less roof penetrations. That is reasonable. I think it makes a better roof. That's one of the most expensive things in an entire house or building is as a roof. So try to minimize those roof penetrations is a good idea. I want to make sure that we continue to use the smaller nail plates. Again, I'm not sure which code right now requires the large. I think IPC, makes the larger nail plates are required versus the UPC. But regardless, I would like to allow the smaller nail plates, allow the blue glue to be used for any type of PVC construction. I think that the auto vents or the air admittance valves ought to be able to be used in kitchen islands on new construction as well as remodel. And if you have a place in the house where, say, you add a bathroom to a basement, for example, and you have a second story in the house, that's a great place for, if you're doing a remodel. Again, for new construction, I understand that's not ideal, but I think as a workaround, if you wanted to add a bathroom basement, for example, that ought to be allowed in that situation. So there are other cases where I think air and maintenance valve does make sense in a remodel situation. So these are things I think that if the UPC could be modified to include those ideas, I would support this. But with the idea that we're going to just go to UPC as written without these amendments, in my opinion, it actually and Chris, you talked about the cost of materials, but it's also the cost of labor. It actually adds to the entire cost of the plumbing job, and these are things inside the walls that people don't even think about that cause that allows your plumbing to work and work very well with for forever as long as the building's in place. So we certainly want to have a good system, but we don't want to make sure we don't overbuild it so that everything works as it needs to work, but we don't put more into that than necessary. So there's a balance, and I think the balance is a UPC is a very good system. With these amendments, makes it much better. And I think that IPC, although I think there's some advantages to IPC, take those good things of IPC and put them into UPC, you end up with one code. I've been saying this for years, so let's be clear. I'm not against the idea of one code, but it needs to be a code that actually incorporates the changes that need to be made. And I think everything we just talked about just a minute ago, the last couple of minutes here, are very important for discussion. So I would urge the board, please consider these changes. And if you can amend the UPC to incorporate these ideas, I'll support it. Thank you.
I will bring your concerns to the Code Review Committee and the Plumbing Board, sir.
Thank you so much. Thank you for all you do for Sedgwick County.
You are welcome, sir. Thank you.
Thanks.
Was there anything further, Commission?
I don't see other questions. No, I don't see other questions. Chris, I think you, and you had mentioned in your earlier presentation that the board is pretty united about trying to make some exceptions and amendments to the UPC, which is exactly what Commissioner's referencing. So thank you for the presentation. All right.
You're welcome.
No other questions? Any closing comments, Chris? Or has you got another?
And you made them for me, Chairman. Thank you. That yes, both the Plumbing Board and the Review Committee I can assure you, sir, have discussed this several times. They are aware exactly that we would have further discussion and look, and we will, just like with everything else, as they continue to develop their review, we'll provide that information to you all as desired and to whatever level of detail you would like, and certainly come meet. Commissioner Howell, we're happy again to come meet before we even get into the formal set the hearing process, et cetera, and see if that met your requests and expectations.
Okay. Thanks again, Chris. Thanks for all you do and your staff. I know it's a busy times.
It has been. Thank you,
It's nice
Chairman.
to know that there's a lot of construction going on. That's
It is.
encouraging.
It is. It's remained steady.
Okay. All right, next,
Chairman,
Mr.
next
Stoltz.
Chris Stewart's going to come up and give a demonstration of my sidewalk, and then Tim will talk about vaccines, and finally Chris Duncan will talk about the dashboard. So, Chris, we'll start with you.
Morning.
Good morning, Commissioners and Board of Health. Chris Stewart, Deputy Health Director. A community health assessment is performed every 3 years in Sedgwick County by the Health Department, United Way of the Plains, and Ascension Via Christi. A community health assessment includes gathering and analyzing many types of data to describe the health of Sedgwick County residents. In previous years, the Sedgwick County Health Department Data Book was a way to provide the community health assessment data. The data book was a great document, had a lot of data in it, but it was static and hard to update. Today, I will show you the new interactive community health assessment data. It is in the form of a website on a My Sidewalk platform. The data is interactive and accessible to the community. My Sidewalk is a company in Kansas City that creates and hosts data visualization and data analytics websites for different types of businesses in the United States, including public health departments. Before the health department partnered with My Sidewalk, we realized we were not telling the story of Sedgwick County's health in the way we wanted to. We needed a narrative to go along with the facts and figures. My Sidewalk helps us do that. In addition, their platform automatically updates national and state databases when new data are available. Now I'd like to show you the Sedgwick County Community Health Assessment. So to get there, this is the Health Department main page. So this isn't the county main page, this is the Health Department main page. There are two different ways to get there. You can scroll through the banners and click on the Community Health Assessment banner. The other way to get there is back to the Health Department page, is to go to Health Assessment and Planning and click on that link, and then click on the 2019 Community Health Assessment. Okay, so this is the first page of the Community Health Assessment, and notice over here, this is where you can tell where you are. So we're now on our story, and notice that the front page begins with a reminder that health begins locally in our communities. And then this first page continues with information about what a community health assessment is, and then highlights a few pieces of data. Life expectancy at birth, there's a map right here. And then what I'd like to show you on this first page are two different parts, sources of information, of data that we got for the community health assessment. One was the community listening sessions that the health department did in 2019 in vulnerable areas of our community. And so that data is here, and there's a picture. And then another thing I'd like to point out is another source of data for the community health assessment is the 2019 Community Needs Assessment, and that's United Way of the Plains, Ascension, Via Christi, and the Sedgwick County Health Department partnering together for that, and there's a link to go to that data. So the rest of the data that I'm showing you on the website is state, local, and national data. So back up here, so we just looked at our story, and then there's a link here how to use this dashboard. And then let's scroll down here, there's different health topics here. So what I'm going to start with is social and economic factors. So in this page, you can scroll down and see explore how income and poverty affect health. And one of the ways you can do that is by looking at the data down here. So before we start looking at the actual data, let's talk about the graphic itself. So within each part of the Community Health Assessment website, there are graphics. And you can see these dots here. Each dot stands for a different graphic. So right now we're on the first graphic, which is the blue dot, and it's showing this median household income. You can scroll through the different graphics by using the arrows on the sides, or you can touch the actual button up here, the circle, and go to that particular graphic. Other thing I'd like to show you is here is you can click on this. Each graphic has a little symbol here with bars and an arrow. You can click on it, and then you can export the data that's in the graphic. So in this case, you can only export as a CSV file, which is kind of like an Excel file. You can export the actual data. If it was a map or an image, you could export it as an image file. The other thing, you can barely see it on here, is when you scroll over here, you can click on this paperclip, and the paperclip actually copies that image, and then you can paste it into a text message or into an email, and you can send it to a friend, and then they will go directly to that graphic. The last thing I'd like to show you about on the graphics are each one of them should have a source. So in this case, the source is the U.S. Census American Community Survey 5-year estimate, 2015 to 2019. So that's where this data here is from. And then down here in this map, like to show you, again, you can, let's see here, you can click on this export of a map, and there's more options to export the map with. And then on the map, you can see that there's different colors. So this one shows the population, this map shows the population living in poverty. This is Sedgwick County here. And the higher, the darker the color, the more the percent of population living in poverty. And you can actually scroll down, zoom down, and see streets and more information as you scroll down. So you can kind of know where you are. And then you can click on each area and call up the actual percentage in that census tract of people living below the poverty level.
Are these broken down by zip?
It's census tract on here. So that's even smaller than a zip code. And census tract are, some people feel they're better than a zip code because it's kind of more equal numbers of people. Zip codes have different numbers of people in each one. So a census tract has kind of standardized the number of people so you can kind of compare from area to area in general.
How could we get this in zip code?
I'm sure that we can, yes. So one of the things about My Sidewalk is we can also create reports on the back end. So what is not shown on here, we can go into it and create a standardized report and could show that, yes. And so back up here, this particular kind of graphic is called a call out. And it shows the median household income in Sedgwick County and then compared to Kansas, and the people living in poverty, percent of the population in Sedgwick County and then in Kansas. So I'm going to hop back up to the top here. So again, we just looked at social and economic factors. And then there's causes of mortality is the next section. You can scroll through and determine the top causes of death and disease in our community, listed here. And all the graphs are interactive, so you can click on them and get more information. I'd like to, I'm sorry, let's go back up to social and economic factors. I forgot to show you about different types of data display. So back up here, when I was telling you about the different graphs that are on here, we'll go through some of them. So this is a call out, and then this one is tables. So this shows people living in poverty by race, ethnicity in a table form. The third one is also a table, which shows median household income by race, ethnicity. And then the fourth is a bar chart, which shows people living in poverty by age and then median income by householder age. The next chart is a pie chart. And this one shows language spoken at home by total population. So this is the total population of Sedgwick County, and the language is spoken at home. And then if you scroll down, you can compare that to the language spoken at home by people living in poverty. So it's a comparison of total population to the people living in poverty. And the next chart is similar, although it shows all families with children, pie chart, and then families with children living in poverty. So you can compare the two. And notice that the orange is very striking here. Majority, 62.7% of families with children living in poverty are female, no husband with children. So that's what that data is showing you. And then there's a few other types of graphs that you can look at by here. You can look at poverty by sex, and then there are some line charts as well. Poverty over time, and here's household income over time. And this one actually compares Sedgwick County to Kansas, and you can see the years on the x-axis and the median household income on the y-axis. So then the next section is causes of mortality. And that is down here, leading causes of death. You can scroll through and look there, and there are a couple graphs under this section. And then we get to a couple other health topics. So healthy beginnings, which is infants and mothers, talking about that. And each of these sections here, lifelong health, behavioral health, safe communities, and protecting health, has 3 subtopics underneath it. So you can explore environmental and social factors, behavioral factors, and health outcomes under each of these topics. I wanted to show you lifelong health, which is healthy choices, eating, and then chronic disease. I wanted to show you the map down here. Oops. Oh, here, under health outcomes. Under health outcomes on lifelong health, there's a map of obesity among adults. So again, it is showing the darker areas are the areas of Sedgwick County with a greater population of obesity among adults. And then behavioral health, mental health is included in there, and substance misuse. Safe Communities has some crime information and information from student surveys. And then Protecting Health has health department data, reportable diseases, and immunizations data. And that includes, local health department data. Also, newly added is a section of COVID-19, and this just goes to our COVID dashboard. There, just a link to that. So, we are excited about the new community health dashboard. Residents can look up local data, partners can use the data for grant applications, and policymakers can use the data to make decisions. So I'll be happy to take any questions at this time.
Okay, Commissioner Cruz.
Thank you. Can we go back to the social and economic factors
Sure.
under the poverty by family type?
Sure.
This,
Poverty by family type.
it's like I think it's bullet
This
number 4. Oh, poverty by,
This one?
oh, maybe it's there. Okay, so it's poverty by language spoken. It's
Oh,
number
okay,
5.
this one. Okay, yes.
So when you scroll down a little bit, it talks
Sure.
about third grade English language
Oh,
skills.
yes. Mm-hmm.
Have we ever tried to capture data of children who are bilingual?
What type of data?
So, for instance, my children went to Horace Mann Dual Language Magnet, and a lot of those children speak both Spanish and English.
Yes.
And I'm wondering, in our community, I think that's I don't know, I just would like to see how many children, we're talking about they're having an issue with English language proficiency, but what amount of those students actually speak Spanish?
Correct. You mean how they fit in here? Is that what
Yeah.
you mean, like a subset?
Yeah.
We could try to get that information for you. Mm-hmm.
Okay, that's the only question I have so far.
Okay.
Thanks.
Okay.
And, go ahead.
Go ahead.
I was going to say interactive again, so you can click on and get more information. I don't think I did that as well. I
Right.
didn't show that as well.
Okay, good information.
Okay.
This is a health assessment required every 3 years?
Every 3
Did I see
years,
that?
yes.
Yeah.
Yeah, we
Okay.
partner with Ascension Via Christi and United Way of the Plains to do that.
All right. Very good. Any other questions from the commission?
Hold on.
Commissioner Cruz?
Sorry, there's a ton of info here. I
Right.
love this. I'm so excited that this is here. On the behavioral health tab, we talk about binge drinking. They talk about suicide. Do they talk about substance? Okay, so they have a mental health provider ratio, but behavior health. What tab is that? Oh, health outcome. Okay, I'm sorry. I just need to check it out.
Sure.
Thank you for this. This is
Sure.
really great info.
Yeah, let us know if you have any more questions,
Okay,
too.
awesome.
Thank you.
Okay. Oh, Commissioner Howell?
Thank you, Chairman. I don't really have a question. I do have just want to say thank you. This is quite good, and I'm looking at the data on my cell phone. Sometimes things don't work very well on cell phone, but this works fantastically. So whoever decided to put this platform up, kudos to that decision. Very well done, and I'm looking forward to digging through the data. I want to say thank you for bringing this to us and explaining this to us this morning.
Thank you.
Thank you.
Okay. I don't see any other questions.
Okay, thank you.
Much appreciated. Okay. Next up, Mr. Tim. Good morning.
Good morning, Commissioners. Tim Kaufman, Deputy County Manager. I'll run through some vaccine information for you fairly quickly. Last week we did, that's not what I wanted to do. Last week we did almost 6,800 doses. We are now at 99,000 fully vaccinated, either second dose or the single dose Johnson & Johnson. and over 208,000 cumulative doses delivered by the health department. Right now, we continue to do appointments and walk-in vaccinations for anyone age 16 and older. I wanted to highlight the Evergreen Recreational Center event that happened this past weekend. We administered 115 doses, so it was a very successful partner clinic, and we've got May 22nd scheduled as our second dose. And what I understand is that almost everyone that was there at that clinic spoke Spanish as their primary language, and so it was good for us to be able to get into that community and help vaccinate in that area. So we had a great partnership to make that work. We are increasing the number of mobile and partner pods as we see activity at 223 South Main diminish. And we've also on our web, we've got notification about the website Vaccine Finder, which allows anyone to go find a vaccine provider, whether it's the health department vaccine provider or a community provider. The pharmacies, the grocery stores, those folks are all listed at vaccinefinder.org. So that's a good resource for people. And then I wanted to make sure that people were aware that as we transition to more mobile and partner clinics, if you go to the schedule a vaccine page on the county's website, if you scroll down, it lists all of the mobile and partner pods that we've got as well. This week we've got 5 different mobile clinics across the community. Almost all of them are going to be walk-ins at this point, so lots of opportunities for people. We're trying to cover the entire community, every corner of the county with our partner opportunities. So wanted to make sure that people knew that that was a tool that was available to them as well.
Hey, Tim, can I interrupt just a second? This mobile vaccination is becoming part of the conversation. I know the mayor's out there talking about it and others, so somehow we need to figure out how to highlight that we are actively involved in getting these out, spaced around. I don't know for sure how we do it, but I was asked this morning about that, and I said, well, I think we're doing it. I had no idea. I could have just referenced them to this website. So
we have, I think probably between the ones that we've got confirmed or that we're in process of working out the details, more than 20 at any given point in time.
Yeah, that needs to be
continue
at
to
our
add, so.
fingertips to disperse.
Okay.
I'm sorry, and I got in front of Commissioner Cruz. Commissioner Cruz, go ahead.
Well, I don't know if you're going to get to this, but you talked about our mobile outreach, but what are we doing for homebound folks? Are we working with Meals on Wheels? How are we hitting people
No.
who are immobile?
We're working with the home health agencies because they're the people that deliver health care in people's homes. And so we've got there's at least one, and I think more than one home health agencies that has been identified as a provider. And so if a home health agency isn't signed up with KDHE as a provider that we can transfer to, we work with them to help them understand that, or we may work with that patient to say, here's another option for you. So that's a home health care function that we're partnering with to make sure that those folks get vaccinated as well.
Okay. So this list would theoretically match up with the list we get every day about the vaccine snapshot? Okay.
Correct.
Okay, so I've had a couple of people ask me specific pharmacies and physicians' offices, so that's helpful to know that I can just send them there instead of copying, pasting, all that. The other thing we had talked about was what are we doing in regards to discussions with physicians' offices? Now, I know that physicians don't want to administer these because of cracking open vials and storage and all of that goes with that. But how are we working with them to increase our vaccination rate because people are hearing it from their physicians? What's the plan for that?
We have regular communications with the physicians, particularly through the Medical Society, and Dr. Menz has sent a couple of different communications to physicians, encouraging them to become more active as providers. Anyone who, and as we move towards the younger ages being approved for vaccines, it's more common for physicians' offices to deliver vaccines for kids. And so if a doctor's office, if a physician is an approved vaccine provider, they can order vaccine directly from KDHE. They don't have to get it through us, but we're happy to work with them and do transfers as well. So we're communicating with them on a regular basis to try and encourage them and to prepare them for the younger folks that will be soon eligible for vaccine.
Okay, and then one final question. You know, as we see a decrease in, I mean, we have the vaccines, right? I mean, that's not our shortage anymore. But we're seeing folks not utilize the vaccine. So at what point do we make a decision around keeping the library open, or how do we transition, and what is the communication to the community around how, if we're going to go to this mobile model more, or what is the plan for that? Did I jump the gun?
You did just a tiny bit, but that's okay.
Well, he let me in. It's his fault.
The biggest concern for us is that declining first dose appointment. And so we are in the process now of modifying our clinic hours. We're going to back them off a little bit. And we know that there will be a time when it doesn't make sense for us to operate that clinic. We know that we're going to be there for at least the next 5 or 6 weeks. And it really depends. That last bullet point talks about the possible approval for Pfizer vaccine being eligible for kids aged 12 to 15 being eligible. That may extend our time in the mass clinic just a little bit longer. But we also know, because we've started to survey parents as well, where do you want your child to be vaccinated? And almost always their preference is going to be in their doctor's office. So we need to get the doctors to step up a little bit. But if they can't, we're going to continue to be able to deliver that service for them. So we know that we'll be there for at least 5 or 6 more weeks in pretty much the same way we are now, 5 or 6 days a week. But we're going to try and continue to add more mobiles so that we can meet the needs of folks that can't make it downtown or that just don't have an interest in going downtown. So we know that we're probably 5 to 6 weeks away. We're going to continue to monitor the data. I looked in the first week of April, we delivered 7,000 or 8,000 first doses. And the last week of April, we delivered about 1,100. So, just a precipitous drop in the number of folks that are coming in for that first appointment. And as that continues to happen, the demand for a mass clinic is going to go down. We'll eventually transition to the clinic that the health department operates on West Central for vaccinations. But we're monitoring utilization, and we'll make those adjustments as we go. One final thing that I wanted to mention today is that I'm sure you've seen stories in the national media about different incentives that states may be offering, that private entities offer. We are in the process of piloting an incentive program. This week we're doing clinics in both Hilltop and Plainview, the Hilltop and Plainview area. Both of them score very high on the state social vulnerability index across all races. And so in those two areas, we're doing some outreach early before we go to let people know that we're going to be there. But for example, Thursday we'll be there in Hilltop, and we will have, based on some information that we received from the Lord's Diner, we're going to put together a food package and make that available. And so anyone who receives a donation, we're going to also, or receives a vaccination, will receive a box of food for their family as well. And so this is a pilot, and we think that it's going to work. And so we're going to spread that out across the community as well, again, based on some of those vulnerability index data that we have. And now we're to the point where fairly soon we'll be able to use things like My Sidewalk to help us make those decisions as well. But the state, KDHE has their social vulnerability index data available, and we can use that to help guide decisions on where we try to incentivize. And we're really open to private businesses that want to do things to encourage what we see as healthy behavior. The Wichita Thunder has a date upcoming where if you've received a vaccine, you can get free tickets for one of their hockey games. We encourage that type of thing as well. Anything that the community can do to help encourage vaccinations, we're in support of.
Tim, you got another question from Commissioner Dennis?
Okay.
If that's right.
Thank you, Mr. Chairman. I appreciate it. I don't really have a question. I just want to let you know I did finally get the first dose the other day. It was just like 8 or 9 times that I've been over there touring. It was a well-oiled machine. They're doing a great job. I appreciate it. We've been able to tour it when it was at the Intrust Bank Arena, when we did the drive-through. I've been over to the library, so it is fantastic. I want to congratulate everybody for that. I did go through, I couldn't see it on the screen, but I did pulled it up on my phone and saw the mobile outreach locations and saw that you are getting some out in western Sedgwick County. I appreciate that. The one town that you didn't have on there is Mount Hope, so if you ever have a chance, it's probably the furthest out, and it doesn't have any pharmacies anywhere close, so take a look at Mount Hope sometime.
Absolutely.
I appreciate it. Thank you.
Okay. And Commissioner Cruz?
Thank you. One last question. You know, we've been hearing about switching from vaccinations to positive test rates. You know, we've been hearing about the new variants that are here. Our positive test rate is increasing. What would you tell the community with the news of more people testing positive now for different strains that increase quicker, that infect quicker?
We have vaccines available. The best defense against the variants, the best defense against the disease is vaccine, and so I would encourage anyone to either make an appointment or just walk in. We've got vaccines available, so that would be my recommendation.
And practicing healthy habits and all. Okay.
Okay. Commissioner Howell?
Well, thank you, Mr. Chairman. And Chairman, I heard you on the radio this morning, and I think it is it's obviously a concern that our positivity rate and our hospitalization rate have both climbed a little bit in the last couple of weeks. And I think one of the takeaways of this that I think is maybe the most important part of the message here is that virtually all of those that are hospitalized have not had the vaccine. And I think that's a very important, distinct point to be made. I don't know if we can tailor our advertising or tailor some of our messaging. I think that's for anybody who's on the fence about this. And again, I asked before, I don't know what the average hospitalization stay is or the average hospitalization cost is. But if I knew there was a chance that I would have a 10-day hospital stay and would cost, $250,000 or something, it would be a pretty good incentive to get a vaccine. And I think if we knew those numbers, it would be very helpful. And I think if we could somehow connect those dots between, if you're on the fence on getting the vaccine, please understand this. We have 70 people in the hospital today as a consequence of contracting this virus, and the average cost is this. I think that is a very compelling argument. And I think that we're missing an opportunity if we don't make that very clear to people who may be a little bit resistant to getting the vaccine. So I think that we have an opportunity, and I don't know where we can use it or how we can use it, but I do think that's a very important point to be made.
We have a communications meeting this afternoon, and so we'll discuss that, and we'll certainly talk to our healthcare partners as well, because they can be giving that message as we can.
Sure, thank you.
Okay, Tim, the other thing, Adrian was really helpful yesterday. So your first slide showed Sedgwick County administering whatever, 95,000. How many first dose? 99,000 as of yesterday. But she referred, if I was going to quote, which I did, to the WebIZ information, which is, it's still reported. The timing of report and all of that is still delayed or whatever, but that number was like 178,000 first doses, which is significantly higher than our first doses. But I don't know if that's...
So every Wednesday, KDHE makes that number available, and so that includes all of the other partner providers with a couple of exceptions. Doesn't include the VA, doesn't include some of the federal folks. But then we make that data available in our newsletter and that sort of thing. But it's about 4 or 5 days behind by the time.
So it's a weekly, it's not daily
report.
Like what we're trying to do with our reports. But it's a weekly, and again, it's if people aren't reporting timely, then it's not actual. But it is we've all felt like, well, we know that our community is getting vaccinated way more than just the Sedgwick County Health Department. But
Sure.
to have an actual number or a reference number was kind of helpful. So thanks for explaining that. Do you have anything else, Tim? I don't see
I
other
do
questions.
not.
I think we'll transition and see if we can get Chris on the Zoom here, Chris Duncan on the Zoom. And while we're trying to do that, to Commissioner Howe's point, when we got data from the hospitals, almost exclusively, and we're talking one or two only, but almost exclusively all of the hospital people are unvaccinated and are eligible for vaccine. So his point is well taken on that. I think that's true. That needs to be said. The dashboard has been up now for over a year. It was originally created as a mechanism to help communicate to citizens and to the Board of Health about trends and tendencies of the virus. One of the things we've been looking at is another way, and Commissioner Howell and I discussed this probably a month ago now, another way to show the 14-day rolling average. And Chris has worked with this over the last few weeks, and if he's on, I would like him to just kind of talk us through this and show us potentially what I think is going to be a new slide we could, if the commission's okay, putting on to the website right after the 14-day rolling average so that citizens could see it two different ways. So Chris, are you on?
Yes.
Okay, why don't you take the commission through this, please?
Okay. Good morning, Chris Duncan, ERP. Basically what you see here on the screen is what exists in the middle of the current dashboard. We added some clarification about what the 5% positivity rate really means to the community, and the health department can explain that better than I can, of course. But of course, we've seen this every day for the last year. It's has the ability to slide. You see the positive cases down here, which are a little hard to see, and you see the negative tests, and then you see the rolling positivity rate. So the only thing that we basically did was add a second view that just highlights the number of positive cases, and then kind of a rolling 14-day average of positive cases. And from there, you can toggle back and forth on the main screen from here to there. You kind of see where we're at 5.5% positivity rate. The last time that kind of happens right around Valentine's Day here. So to put it in perspective, if you went to Valentine's Day over here, you were looking at, around 100 cases, maybe less than 100 cases per day. And so when you look down to today, you can scroll and see a little better. You're still under 100 cases, but they are climbing. But it just puts positives in front of you in a highlighted manner. It's just the same data that we're already recording. It's just a different view of it.
I don't think you're toggling back. I don't think you're toggling back and forth. We're just seeing one screen. We're not able to go back and forth as you're discussing, which I think would be valuable. But if not,
Chris, if you're on the phone, we're not seeing the screen toggling. It looks like you have what's entitled Sedgwick County COVID-19 test data posted by test date, positive daily counts. Are we looking just at one slide, or are you intending to toggle back and forth?
This is actually the report that gets embedded inside that dashboard, the centerpiece. So this is exactly how it would look inside the container.
So it's just one slide. You're not.
I'm sorry, I didn't catch that.
It's just one slide. You don't mean to be toggling back and forth.
Oh, you want them on one slide?
No, I'm asking if you, this is the problem with
Sorry for
Zoom
the
calls, right?
question. That's all right.
I'm asking if you're intending the commission to see two slides that you're toggling back and forth, because we are not seeing that here. We're only seeing one slide. Is that what you intended to do?
Yeah, you should see one that has a little yellow arrow up in the right corner.
Okay.
Left corner.
Left corner.
Left corner.
Chris, go to the one that we have on the dashboard today, and then go to the one that you're trying to show us that you've worked on.
Okay. Do you see the web page now that's existing today?
No, we just see the one that you're working on. Okay, now we see the one on the website, but it's very small.
Yeah. And let me adjust that. How about now?
Can you make it a tad bigger?
Sure.
Can you see that okay, commissioners? Okay, so Chris, this is the one that we currently have on the dashboard today. Can you concentrate on that a little bit and then toggle to the one that you're working on and talk about the one that you're working on?
Right. So this center piece here would just get swapped out with the one I was trying to show you. So this piece actually stays there. And then what you would have up in the corner is just the ability to see a different view with just the positive cases.
Okay. Okay. Very helpful.
So we'll roll that if the commission's okay. The dashboard has been rather static the last year. This would be an additional tool that people could use to look at it a bit different way, so. And any other comments or any other suggestions on dashboard, I think.
Okay. Commissioner Howell?
I just want to say thank you to Chris for doing this. I have created this chart by myself by spending, it seems like, hours each time I do this. I do it a couple times a week to look at this. And the reason I do that is because the normal chart that we look at today, those numbers are primarily driven by the number of tests, and the majority of those tests are not positive. And so we see some dynamic calculations here that are being driven primarily by people who don't have COVID. And I just think that is a little bit, it's not clear enough, in my opinion, as to what's going on in this community. I would call this an infectiousness rate, if you want to think of it that way, because primarily anybody who gets COVID-19 in around 7 to 10 days generally is infectious, and after that, probably not. It's not going to be perfect. There's a few people out there that'll be infectious longer than 14 days, but it's a very nice metric. And so if you, again, rather than me having to do this manually just for myself, I think that the community would have an interest in this. I would also say on this particular chart that you see in front of you, the method of calculating the positivity rate takes each day. I had to figure this out the hard way, but each day you have a number of positives and negatives for that day. And each day we calculate a positivity rate for each day. And then those 14 days are averaged together. You get a different answer if you took the total number of positives and the total number of negatives for 14 days and added those together and divided the two numbers by each other, you would get a slightly different number. It could be as much as 1% different. And so I think that there's a little bit to this particular chart that it requires explanation. And again, I know we're familiar with looking at that. I'm not suggesting we change this chart because it's too late. I think we should leave it alone and continue the process. But I do think the other chart, in my opinion, is very valuable because it is driven specifically by the number of positives alone. And I think that the calculation there makes a lot of sense. And so we're not seeing as much variation due to people who don't have COVID. We're seeing a number that is directly related to people who do have COVID. And I think that's why this is a very important chart. Thank you for doing this, Chris, and I do applaud you for putting this on the website. Thank you.
Thanks. Tom, I think it's probably worth, we do have a lot of county business, and between budget and rolling out the next phase of the American Rescue Plans and things like that, there might be, we need to be able to get to this, but we ought to think about, do we want to start communicating on our first homepage, on the homepage, other items that might be current and as in the near future, especially like the rescue plan, the next round of funding, budget, blah, blah, blah. So just my thought, but we still need to be able to get to this.
Sure.
Just don't know that it should be as prevalent as it has been. But you can ask the commissioners how they feel on that and your communication department, just a note. So, thank you.
Thank you. Thanks, Chris. Okay, I think if that's the end of the COVID discussion, if
Okay.
Mike, do you or Justin want to talk about Legislator Keene? Whoever wants to take the charge on this, talk about 286.
Yeah, thank you, Tom. Mike Buffoon, County Councilor. We may briefly talk a little bit about Senate Bill 286 today, but we may be focusing on another bill that has similar, if not worse, consequences. Senate Bill 286 passed out of the Senate Judiciary Committee yesterday, that's what got our attention, and they made some amendments to that, probably over the time that they had prior to veto session. And I know Lindsay and Justin were both working at some of those changes. I think they've improved it some, but it still involves setting aside some of the new ARPA money to reimburse businesses that make application, I believe, still to the Attorney General, and there's a review process and so on. And we were looking at that yesterday when I found out this morning from our lobbyist, Jason Watkins, that the Senate is running today House Bill 2313, which originally started out in the House as a Kansas National Guard motor vehicle property tax exemption bill, which of course went through the House with almost unanimous, if not unanimous, approval, gets sent to the Senate Tax Committee, and Senator Tyson, the chair of the Senate Tax Committee, amends Senate Bill 149 on it, which was a bill we've talked about a lot, which involves the county reimbursing property taxes to businesses that were affected by a government shutdown. Now, they have made a number of changes from Senate Bill 149, and I think Justin will try to, as best as we can, because it's all coming up very quickly. We do have the supplemental note that we received on this new bill. But the process, I think Jason thinks that this bill is probably going to pass the Senate today. And if it passes the Senate, 286 is probably then off the table, because both of these bills try to accomplish the same thing, and I don't think at this point we see both of these bills passing. But if the bill does pass the Senate today, what it'll probably do then is go to conference committee, and then maybe some of the elements of 286 get back in at that point. But I'll let Justin talk a little bit about what Senate Bill 20 or House Bill 2313 does. And as I said, there's a possibility that today we hear that it passes out of the Senate. So, Justin?
Sure. Commissioner Justin Wagoner, Assistant County Counselor. I'll do my best to summarize the Senate substitute for House Bill 2313. It really has two distinct parts to it that I'll try to summarize and focus on primarily. The first deals with the ability to claim property tax relief, or essentially a payment by businesses that pay property taxes or pay rent that were either shut down or restricted by COVID-19 actions. These businesses, and I'll get into a little bit more detail here in a second as to who's qualified and who's not able to file those types of claims under this bill draft as it's currently worded, would be able to get a tax break. This would be for the tax years of 2020 and 2021 of up to $2,500 per business from the county. Altogether, they can get up to $7,500 per year per business, but 2/3 of that would be paid by the state. 1/3 would be, in our case, by the county. So it'd be I think by total per business, it could be up to $5,000 per business if they were eligible for both years and eligible for the maximum amount allowed. I won't get into a lot of detail about the formula that the bill has. I'll just say it's somewhat complicated as to whether it's a shutdown or a restriction and how it applies. The terms are certainly not well defined in the bill. And it applies a formula of sorts to where they can qualify for a certain amount of relief, again, not to exceed the $2,500 from the county per business per tax year for 2020 and 2021. And then I wanted to mention who is eligible. It has to be a for-profit business that's in operation on July 1st of 2019 and March 1st of 2020, and filing a 2019 tax return with revenues between $10,000 and $2.5 million in 2019. And then they had to have less gross revenue in 2020 or 2021 than what they had in 2019. It exempts out several businesses. I'm not going to read every single one, but I'll read the first handful. Grocery stores, pharmacy, hardware stores, home improvement businesses, liquor stores, manufacturers, and food processors. That's a smattering of the businesses that would not be eligible for relief. I believe the legislative intent was to not allow businesses that were maybe less impacted or not impacted, or maybe even in some cases had higher sales during COVID-19. So that's the first portion of the bill. Again, that has to do with businesses that pay property taxes or that pay rent. And these claims would be submitted to the Kansas Department of Revenue. The second part of the bill, which would also have any claims submitted to the Kansas Department of Revenue, is much more open-ended. It would begin, any eligibility for relief would begin January 1st of 2022. There are not any limitations on types of business for this portion. It's section 15 of the bill. And it's, again, open-ended on business type. There's no limit on the amount of tax relief that could be set by business. It also, so in other words, you could have big box stores that could qualify for tax relief under section 15 of this bill. And so they wouldn't be eligible for the relief until 2022, but it could apply for past tax years during which COVID-19 actions were taken. And again, it utilizes the shutdown or limited language that, again, is not very clearly defined. It has a formula based on the number of years out of 365 days, the number of days out of 365 that the business was shut down, and that's the portion of tax relief that they could claim, up to the entirety of their taxes. I believe, and Lindsay can correct me if I'm wrong on any of this, but I believe this has the same, I would say, a deficiency or logical deficiency in that it would also have the result of having the counties having to pay back or reimburse taxes that the county never got. There were actually city taxes, school district taxes, other taxing subdivisions. Again, I defer if Lindsay has a different read of that, but it doesn't. It appears that all that money could come out of the county general fund, so I think it's pretty broad in scope. The similar language, I think, was in at least one or two of these prior bills. I know the county commission certainly objected to some of that language or requested that it be taken out, and I think it was at one point out of one of those bills. The other thing I was going to mention on this is there's, I think the biggest concern here, and Lindsay can speak more to this, is that certainly on the 2022 county budget, this could have a major impact. And I would say it's probably more of a budget concern. I defer again to Lindsay, but in relation to the other portion of the bill, I think section 15 is probably the part that's more concerning financially to the county. I'll briefly talk about the substitute for Senate Bill 286 that Mike mentioned. This would not impact the property tax base of the county, or at least not now. There's certainly the potential that it could down the line. What this bill initially did, as of yesterday, it said that the county would have to set aside 25% of our ARPA funding. They amended it yesterday during a hearing to 100% of the ARPA funding would have to be set aside. And then the bill proposes the state, I believe there are 3 appointments on the state board, one by the governor, one by I think it was the Speaker of the House, and one by the Senate President, if I remember correctly, they would weigh any claims that would come in. It sets criteria for them to establish for any of these claims that would be made, but it makes no limit on how much relief could be provided. It sets a number of considerations for them to be made, and there's really no transparency. In fact, it specifically says that any information submitted would not be subject to disclosure of any type, whether Kansas Open Records Act, lawsuit, subpoena, any of that. And so it sets forward this process, and this three-member board would then decide how much money is given in relief to these businesses. A portion, and I'm trying to recall exactly, but a portion would come from the state or the county, depending on how the orders applied. And I think it gives the board a pretty free hand to decide how that should be applied based on whose order is more or less restrictive, and if there are overlapping orders that were in place. But again, I think that probably the key thing there to know is that bill would likely be in conflict with what we think. We're not 100%, they haven't come out with the ARPA guidance yet and the regulations. But if it looks like the CARES Act guidance and regulations, which from what I've heard from Lindsay, that's what our consultants on that think it will come out looking like that. That guidance says that federal or the state governments cannot control how municipalities spend ARPA funding. So it would probably be in conflict with that federal law. I would imagine the bill could also act as an impediment to the county getting this money out to the community, because the very first thing that we would have to do is take 100% of the money and put it in a fund, and then the state would go through this process. That's if you followed the state bill to the letter of the law. Obviously, there's a conflict of law issue there that could be very complicated. That's the summary of both of the bills. I'd invite if Lindsay has any clarifications or additions, or any questions you might have. I'll do my best to answer those.
Probably a couple questions. Start with Commissioner Cruz.
Thank you, Chairman. Thank you, Justin, for that explanation. Do either of these talk about funds that were already received by these businesses, whether it be PPP loans or any of the economic recovery funds that we gave to them as a county government in our first CARES round?
Yes, Commissioner Cruz. Oh, sorry, Mike, go right
I
ahead.
was just going to say, they have tried to improve some of the criticisms that they've been receiving on Senate Bill 149, and one of the restrictions to be an eligible claimant is you cannot have received more than a total of $150,000 in prior COVID relief funds from either local, state, or federal funding. Okay. And actually, that would cover a lot of the larger businesses, at least Jason thinks that. So that'll eliminate a lot of them if they've received that. So.
And then you talked about what the definition would be for the shutdown or restrictions. Like, do they have those defined or they're not defined?
I'll do my best to describe how they're defined. They're not in the definition section of the bill, which is where you'd usually anticipate they would be. It says if the retail storefront was operationally shut down or restricted.
Like restricted how, I guess? Like masks were a restriction, hours of operation. Does it go into any of that?
It never refers to masking as being a restriction. Okay. I believe there are other parts of the bill. Certainly the Senate, the summary note on it talked about capacity limitations. I'm not sure that I saw that specifically referenced in the text of the bill. I'm trying to see if Section 15 may have had something on that. Section 15 does say was shut down or limited in any capacity from conducting operations. And so I think there's a pretty strong argument that requiring folks to wear a mask is not shutting down the operations.
That was just an example. So, yeah. I just wondered if it was written out.
So capacity, you might think limited 50% occupancy or limited
That's possible hours. that could apply. There's certainly arguments on both sides.
No, you're good. So what does it, I wonder, there were businesses that willingly shut down because their owner, for whatever reason, didn't want to operate. And then I wonder, the argument was made at the State House the other day around, there was a conflict between the attorney and his wife. The wife didn't want to go out at all. He was okay going out in eating in restaurants, but the wife hasn't gone out in a whole year. So you wonder, and I'm probably getting into something here that I shouldn't, but I think it's important to understand, like, there are people that didn't even want to go out because so I wonder, I think the argument can be made that some businesses decided to shut down on their own. Some businesses, yes, were, I guess, essentially in a way, they feel they were forced to shut down. But there were, at what percentage of the population, I wonder, of people decided not to go out on their own, which affected businesses? How does that factor into all of this?
That's a good question, Commissioner Cruz. And Lindsay was just actually reminding me of the same thing that's very much responsive to your question, which is that there's a laundry list of factors. This is under Senate Bill 286 specifically. There's a laundry list of factors that 3-member board at the state level would look at. One of them specifically is the extent to which non-governmental orders or restrictions and consumer behavior contributed to the monetary loss claimed by the business. And then it says the board shall quantify the amount of claimed loss attributable to those things. And so I think what you're talking about is that obviously consumer behavior changed as a result of COVID-19 across the country. And certainly within the state of Kansas. And so that's a factor here. And it says this board can hire like a consultant, I think, somebody who would be an expert maybe on some of these matters to figure out how much of impact on certain businesses may have been accrued. How the board would handle that, there's a lot of factors they look at. So that factor is not necessarily controlling. It's one of 7 factors that they have established for that board to look at.
And who did you say was on that board again?
It'd be 3 people that would be appointed one by the governor, one by I believe it was the Speaker of the House, and then I believe it was one by the Senate President, if I remember correctly. Trying to find where that's at specifically. What's that? Thank you, Lindsay.
Thank you, those are all my questions.
So is that 3-person panel different than the Department of Revenue you referenced on the other bill, the House bill?
That's correct, it is.
would that be-
There's the House bill, the one that Mike was saying is more likely, it maybe has a little more momentum in Topeka, does not have a 3-person board. Instead, it has the Kansas Department of Revenue to administer. It also says they can develop rules and regulations for administering the bill and the provisions that are in it. And so in that case, you'd have the Kansas Department of Revenue administering it and applying the bill to the claims that would be submitted.
Mr. Chairman, if I could jump in, because it is getting confusing jumping back and forth between the 2 bills.
I get it.
It might be easier to focus on 2313 because we know that bill is going to the Senate. At this point, we don't know if 286 has passed out of committee, but it's never even passed one of the chambers. I mean, it hasn't even been set to go in front of the full Senate. So if 2313 passes today, we can focus on that bill. And that was the bill I was referencing, has the $150,000 limitation if they've already received state or federal funds. Lindsay pointed out to me, and I want to make sure I clarify it for Commissioner Cruz, is Senate Bill 286 doesn't have that restriction. So there isn't any 150,000 limitation there.
So you mentioned to go to conference committee. Again, Commissioner Howell's got familiarity with that. So you mentioned, but if House Bill 2313 passes the Senate today, will it go to a conference committee?
More than likely, because the only bill that the House has considered for 2313 has to do with exempting personal property tax for National Guard members. So they haven't really reviewed this portion of the bill.
Right.
But regardless, it has passed the House. If it passes the Senate, then it's conferenceable and would likely go to a conference committee because they don't think at this point in the session it would go back to the House for full review of the amendment that the Senate put on. So that's our best guess at this point anyway.
And that's what Jason thinks
That's what Jason.
likely. Okay. Commissioner Howell?
Well, thank you, Chairman. Just to be clear, 2313, do we know which committee that came through in the House?
In the House?
Yeah.
No, I don't.
That's going to be who's part of the conference committee. That's why I'm asking. If it was a veterans bill originally, then that would be.
Yeah, but it's a tax exemption bill. I assume it went through House tax, but I will have to check.
But you said 2313 was a National Guard bill initially.
Right, it's a
And that's
National
when it
Guard
passed the
bill, but it
House.
dealt with a tax exemption, so I'll bet it went through the House Tax Committee.
Okay, I guess I understood that this was a National Guard bill that came to the Senate with almost unanimous support from the House
Right.
as a National Guard bill. So that would mean that the committee in the House side was probably not a tax committee, it probably was a Veterans Committee or something.
Commissioner Howe, I might, just in
No,
reading
it was-
through that.
It was the House Committee on Taxation. And I think the House Committee on Taxation reviewed it because it dealt with tax exemptions for this
Okay.
group.
All right, so if I understand correctly, what the Senate did was they did a gut and go. They did a Senate substitute for House Bill 2313 by inserting Senate Bill 149. I assume that the original contents may not even be in that bill at this
No,
point.
it's still in.
It's
not a
still in
gut-
there, okay.
Yeah, there's just an amendment.
Okay, so it's just a germane amendment, okay. At this point, there's no hearings, public hearings at this point going forward. It's going to go to the Senate General Orders, and it's an exempt bill because it came through tax. So at this point, it's going to go to General Orders in the Senate, and beyond that, it's going to go to Conference Committee, most likely, because I don't think that the House will agree to the changes of the Senate without going to conference, probably. So we don't really have a chance to speak to this bill at this point unless we just do it through email or letters to some of these members of the, most likely, members of the Senate and possibly members of the Conference Committee. I would like us to articulate what is exactly our concerns about the bill. As you were speaking, a couple of things I think stand out to me. Number one, it would be, it should be noted that the county should not be responsible for tax dollars that were levied by the county and given to cities and schools. I think that should be one of our complaints, if you will, one of our concerns. Second of all, I think that our liability should only be subject to whether or not the ARPA money can be used for this reimbursement purpose, subject to federal approval. And so if the federal government doesn't allow us to do this, then I don't know that we ought to support that. But to the extent that the ARPA money would be allowed to be used for reimbursement to these businesses, I don't know that I have a problem with using the majority of this money for that reason, if that's allowed. So I think we need to clarify exactly what is our concern.
And I might have Lindsay address the question about the ARPA funding.
So, Commissioner, I think there's two parts to this bill that are concerning, right? The one you referenced, which is Section 15, which basically puts the county on the hook through the county's general fund to reimburse all property taxes based on the number of days in which there was a capacity restriction or shutdown. So that is exclusively said it can be handled through the county general fund. Now, Sections 1 through 14, which is where our, I guess our liability is capped at $2,500 per year for 2 years. That is still intended to be some kind of tax relief. And right now, without having specific guidance from ARPA, the bill itself says ARPA dollars can't be used basically to offset tax increases or to be used basically to supplement. And so my concern would be that the ultimate guidance is going to say that because of the way this is structured, we won't be able to use ARPA because it's basically violating the spirit of that provision of the ARPA law.
Well, since I have you up there, do we have any type of, you said, so it's basically $2,500 per year per business for 2 years, so it's $5,000 for each business. Do we have an estimate what that would potentially cost the county if this was to pass in that form?
We don't. So that's one provision is the $2,500 per business. Because there are so many businesses that are restricted and because we only got it this morning, I'm sorry, I have not been able to do that analysis. But the trickier part is Section 15 because that does not have a cap. It does not have the $150,000 limit on how much maybe federal COVID funding you've received. It's basically your full property taxes that you've paid relative to the number of days. And so there is no cap on that part. And that, again, comes out of the county general fund.
Is it our understanding that these businesses must apply for the consideration for this grant?
Yes. So for the Section 15, they come to the commission for that. That property tax portion, the rest is made up to I guess, depending on what type of rules the state sets out for consideration.
When you say commission, you mean us?
Yes. Okay. Yeah, the Section 15, that property tax dollars, it says may make application to the Board of County Commissioners for that relief.
All right. Well, I'll just say this, that I anticipate the legislature will probably be adjourning in approximately a week from today. I don't think they'll be there much longer than a week. They probably will work over this next weekend if necessary, is my guess. And so this is happening pretty quickly, and if we want to speak to this, we need to agree to speak to it pretty quickly. Otherwise, we're not going to be heard. So I guess I would like it if we could articulate, some of our concerns. Maybe tomorrow at the BOCC meeting, we could come back with some type of a proposal and a letter we could send on behalf of the commission here that would be sent out, hopefully with Sedgwick County's perspective or opinion on this bill. I'll just say this, that the legislature does seem motivated, and I know that Jason is our lobbyist, and I think he does a tremendous job from a business perspective. And again, he also lobbies on behalf of the Wichita Chamber, Regional Chamber of Commerce, for example. Most of the businesses and business lobbyists are very much in favor of this type of legislation, and there's a lot of pressure in Topeka to move this forward. And I think that's why we're seeing, again, they started back up in the veto session on Monday, and here we are on Tuesday, and already have significant movement on this type of legislation. They're motivated to pass it out. And I understand their side from the Article 5 of the U.S. Constitution talks about that people should not be deprived of life, liberty, property without due process of law, without private property being taken for public use without just compensation. These folks have borne the burden of government on behalf of everyone else. And when we take their property without their consent, without just compensation, there's a constitutional motivation to fix this and make it right. They're not going to stand this down. So I guess I want to be balanced in how we approach this. I think we need to recognize that there's a legitimate need to restore businesses for what has been taken from them, but let's do it in a way that doesn't shift that burden of government to other people. And I think there's ways we can do this, but I think the ARPA money is a key. And I don't know what we can do with that, but we got to be very careful with how we approach this. If all you say is we're opposed to any changes, we don't like these bills, I don't know that we'll be heard. Thank you.
A couple of, one statement, a question. So I understand that the ARPA world was required to have, Treasury was required to have the rules within 60 days of passing, which is May 11th. So if Commissioner Howell is correct, if they're going to adjourn in a week, they may adjourn before the Treasury even issues their guidance. They could be, anyway, so that's another, but crazy stuff has happened before. The other part is, so when you're saying reserve one of these bills, I can't remember which one, reserve 100% of the money, are they requiring all the cities, like City of Wichita, everybody else to?
Any city that had ordered, or that
So
had
when they say
initiated
municipalities, they're saying county and city and,
Yes.
wow, and Bureau of Indian Affairs groups?
Anybody in the state of Kansas this bill speaks specifically to the state, counties, and cities. So I don't know that they try to do the tribal governments.
Okay, interesting. Okay. Commissioner Howell?
Also, let me just be clear that House Bill 2016 that passed in a special session last summer didn't take effect until around June, if not maybe July. And so we did not have any local orders that would restrict businesses before that point, because unless we became more restrictive than the state. But the state itself issued the orders, the executive orders, that caused these restrictions. So would we be responsible for, if we did not issue more restrictive orders in the state, why would we have liability at that point?
I'll do my best to answer that. First off, there were orders issued that may apply under either one of these bills, and some of that's going to be a matter of interpretation, or if it was in litigation, how court would interpret it. So there were orders before, was it House Bill 2016 that passed last summer in the special session. So the county, and then if you look at, for example, Lindsay was talking about Section 15 and this House Bill 2313, it just simply says if there's a governmental order from the county, essentially in this case, they could apply. It doesn't have any offset if there's a state order at the same time that I'm aware. Lindsay, tell me if I'm mixing that up. Sorry, this all come up very quickly. Yeah. So there's no offset under probably what's the most concerning portion in House Bill 2313. If you're talking about, I know that Mike was trying to get us not talking about Senate Bill 286 too much to confuse things. It kind of has a process through which that three-person board would kind of review the different claims that come in and apportion them to who's more or less restrictive. But again, if you're talking about the most concerning part of House Bill 2313, the Section 15 portion, there's no offset if there was a governor's order in place that may have impacted it. And instead, it's based on the number of days that there would have been an order in place that could have had any impact. And you're right, that if there are times where the governor had the only order in place and the county had no order in place, then for those days, there wouldn't be any calculation. But there were other days where conceivably it's possible that having a capacity limitation or mass gathering limitation could apply and result in the county being responsible for, I guess you could call it tax relief. In some ways, it's a penalty, I think, when you're talking about tax money the county never got.
I think the second part of that question would be that in most of these cases, the county commissioners did not actually issue the order, but it was issued by our health officer. So once again, whether it be the health officer or the governor, it wasn't necessarily the county commission that did these orders. And so I guess I'm a little concerned as to why we would have that liability when we didn't actually issue the order.
I think you bring up a good point. The wording in that does contemplate that the action was taken by a political subdivision. It says county, city, or political subdivision related to a state of disaster. It gets back into a similar argument we had on bills earlier where the county didn't take any action under KEMA. Other counties did around the state, but Sedgwick County did not issue any orders from the Board of County Commissioners under KEMA. So there is an argument to be made that this shouldn't apply to us. Whether the state would view it that way or parties who may apply for relief, that's unknown. Obviously, if Section 15 passed as is, I think there's a strong argument to that point, and those hearings would be in front of, well, they're not hearings, I'm sorry, the applications would be to the Board of County Commissioners, and then it directs the county treasurer to reimburse any claims, reimburse any applications determined to be valid. I'm not sure who's supposed to make that determination. It doesn't really say. I would imagine it's to the Board of County Commissioners because it says the applications would be the Board of County Commissioners. It doesn't necessarily vest the county treasurer with making that determination, but that's another portion of the bill that I think is a little unclear.
It should also be noted then if we made a determination that was not agreeable by the applicant, this could be appealed into district court, I assume?
I think that's correct, Commissioner.
Thank you.
Okay, I don't see any other comments. Thanks for the current events. Appreciate it. Okay, Tom, anything else? Okay. All right. Well, we have a commission meeting scheduled at 9 o'clock tomorrow morning, and so with the staff meeting over, we will stand adjourned. Thank you.